This video is going to be all about congestive heart failure. So if you have a patient who comes in with new onset lower leg swelling, new shortness of breath, especially when laying flat or they're elderly, or they have worsening shortness of breath and lower leg edema with established congestive heart failure, you're going to, of course, want to work these patients up. So this is some of what the documentation looks like on Epic. If you need to review this, you can. It just says that they're there for an evaluation of lower leg edema or follow-up of their congestive heart failure. So you can ask them how long they've had the symptoms, if they have a history of heart failure, history of chronic kidney disease, history of high blood pressure, history of lower leg swelling or edema in general, if they use any anti-inflammatory medications like Aleve, Motrin, naproxen, that sort of thing, because that certainly can cause lower leg swelling and side effects, what their salt intake is, and what their fluid intake is, and if they've done anything for treatment, whether that's raising their legs, like elevating their legs or not. And certainly you can ask, when they wake up first thing in the morning, is their swelling worse, then it kind of increases throughout the day, or is it just always the same? Because that may impact how you work these patients up further. And then, of course, the review of systems can lean towards more information, whether they're having coughing as well, or chest pains, or palpitations, or shortness of breath and exertion. If they have any abdominal pain or those sorts of symptoms, urination problems, whether they're not going enough or too little. If they're having headaches, dizziness, passing out. If they have diabetes or thyroid conditions, or if they have any rashes, whether that's weeping from the fluid in their legs, like open sores, etc. So the objective, of course, is to review all their vital signs. That includes their blood pressure, their weight especially, and their heart rate. And then you can do your assessment, of course, listening to their lungs and, of course, listening to their heart, and then looking at their lower legs to see how bad is the extremity edema. Is it pitting? Is it non-pitting? Where is it at exactly? Is it their entire lower leg? Does it go up to their thighs? Is it just their ankles or their feet? So you can get a better idea of how serious and severe that is. Of course, you want to review all their medications when they come in. Some diabetes medicines like Actos can cause or worsen heart failure if they have heart failure already, or if you're suspecting heart failure. Amlodipine or Norvasc as a side effect can cause lower leg swelling. So you need to inquire about how long they've been on that particular medication. If it's been years, it's less likely that it's the culprit. But if it's a recent medication, then that could be one of the causes. Of course, review if they have any diuretics on the med list. That includes diuretics like hydrochlorothiazide that can be part of their blood pressure medication. Yes, it's a low potency diuretic, but it can definitely still help with some of the fluid buildup as well as their blood pressure. Do they have any NSAIDs on the med list? Sometimes patients are taking Mobic or meloxicam every day, or a Totalac or Loading every day. And that definitely can impact, if that's causing the problem. Do they have any beta blockers on their med list? Do you see a prior cardiac history that they have that they need a beta blocker? Sometimes that could be an indicator of something else going on. Of course, you want to consider some labs and some further workup of these patients. You can always order a BNP and a BMP, basically checking to see how the heart's looking, how the kidneys are looking, and how the electrolytes are. Sometimes the BNP can be elevated if patients have underlying kidney issues. So just be aware of that. If they do have like severe chronic kidney disease, that BNP can be falsely like elevated for heart failure issues. So that's not going to be an accurate indicator of whether or not they have heart failure. You'd have to do an ultrasound of their heart to see the severity of that. You can also review in their chart if they've had any past ultrasounds of their heart, because sometimes you can see if they've had heart failure or what kind of looks like early stages of heart failure on their past echo that they've had done. Otherwise, you can look at past chest x-rays as well to see if they have any issues there too. And you could also consider ordering an echo or a chest x-ray if necessary, based again upon presentation and what your suspicions are. Definitely you want to compare their prior weights at their prior office visits to their current weight as of that visit they're at with you now, to see if there is some significant weight increases. A lot of times you will notice that they've gained, 7, 10, 20, sometimes even up to 40, 50, 60 pounds, in such a short period of time. And you definitely can, of course, conclude that that's all water weight. So that definitely needs to be addressed. And of course, looking at their blood pressure and their heart rate at that visit, because if they have an elevated heart rate or issues with their blood pressure, you should manage those, with beta blockers or other blood pressure medications to try to get those down to help with the symptoms. And then, of course, sometimes lower leg swelling can be related to hot weather and excessive walking or being on your feet. Sometimes when the weather gets warmer, the blood, kind of pools down there in your legs because everything dilates in your lower legs, and that certainly can cause some swelling. That's why, again, it's important to ask patients, is the swelling better when you get up first thing in the morning and kind of worsens as the day kind of progresses? Because that could just be other forms of edema that are not related to issues with their heart. Definitely, regardless, the treatment is as follows. So generally, the rule of thumb is furosemide or Lasix, 40 milligrams is equivalent to Bumex at 1 milligram, which is also equivalent to furosemide at 10 milligrams. I typically only prescribe Lasix and Bumex to patients. I really don't use furosemide too often. If the patient is not on a diuretic at all, you can consider starting Lasix 20 milligrams once a day, or you could use it as needed, but then always inform your patient that if they do need it every day, then they need to have follow-up, with blood work to make sure that their kidney function and their potassium levels are being maintained, if they're not taking it, as needed. If they're already on Lasix 20 milligrams once a day, you can consider increasing it to 40 once a day, or 20 milligrams in the morning, 20 milligrams in the early afternoon. We, of course, don't give it to them in the evening time because that can cause them to pee excessively and they're going to be up all night urinating, and that's definitely not something you want for your patient. If they're already on Lasix 40 milligrams twice a day, that's already a big dose. You can consider discontinuing the Lasix and starting Bumex 20 milligrams once daily instead. Sometimes switching up this diuretic helps to pull more fluid off, so you could consider that. Other thoughts, if they're on even like 4 milligrams of Bumex, once a day, or 2 milligrams twice a day, you could consider adding Xeroxilin to, the mix as well. But again, you want to have close follow-up in a week and recheck those labs. You definitely don't want to hurt someone's kidneys and cause them to go into kidney failure, and you definitely don't want to cause severe hypokalemia, that can be really serious and require hospitalization. So you got to pay really close attention to your patients and monitor them. And definitely when they come back in a week, of course, checking their weights is going to be an indicator of whether or not the medication has been working, because if they've lost, a significant amount of weight in such a short period of time, the diuretic is working, even if you don't necessarily see that much fluid removal in their lower legs. That water weight has to have come off from somewhere. So we want to keep close tabs on them. Of course, you can always consider increasing the diuretic temporarily over the course of 3 days to see if more fluid can be pulled off. For example, sometimes you have patients who have known heart failure. They're already on like 20 milligrams of Lasix once a day. The weather got a little bit warmer. They went outside, they walked around a bit, and then all of a sudden they're like, oh my gosh, my swelling in my legs is so much worse. You can just inform those patients that they can take, an additional dose of their Lasix once daily over the course of 3 days. To see if that improves with that swelling, kind of pulls off some more fluid. Of course, again, I would recommend close follow-up with those patients so that they come in, get assessed, get their weights checked, and you can make sure that the medication is working. You certainly don't want to let them just fly under the radar and not have follow-up. And if all else fails and you're, unsure about some things, of course, refer to cardiology. You can always send patients to the hospital for further evaluation if there's significant swelling in their legs, or they have shortness of breath, or you do a chest x-ray in the clinic and you realize that they have, fluid built up in their lungs, or they requiring oxygen when they come into your clinic because their pulse ox is low because of the difficulties breathing and the edema. All those patients should go to the hospital. Certainly, if that's not their normal to not be able to walk, into the clinic, and they're requiring a wheelchair and they're requiring oxygen while they're waiting for you to come into their office visit, those are big red flags that they should not be sent home. They need to be going into the ER and most likely be admitted to the hospital for IV diuretics like Lasix and additional workup with labs and imaging as necessary at the hospital. So those patients you cannot really manage in the clinic at all. And then, of course, education for your patients, if they're needing this, is, of course, make sure they weigh themselves at the same time every single day with the same amount of clothing on. After they've, urinated in the morning, for example, you don't want to have those extra, weight on there. And then they have to be educated to notify you if they gain more than 3 pounds in a day or 5 pounds in a week. Of course, that can be signs of worsening heart failure before they actually notice all the swelling in their legs. Fluid can accumulate in other locations, and it can make it tricky to always note that right away. You definitely want them to limit the salt and fluids in their diet. Less than 2 grams of sodium per day is generally recommended, as well as less than 2 liters of fluid per day. Sometimes those recommendations, of course, can change depending on how severe their heart failure is. And cardiology a lot of times determines how much fluids they should have, as well as nephrology too can also make some recommendations, again, based on what their labs are looking like and how severe everything is. Of course, you want to keep their blood pressure well controlled. That's blood pressure is less than 130/80 is ideal for those patients. And then, of course, educate them to elevate their lower legs above their heart when they're at rest. Getting those legs above their heart helps to pull that fluid off considerably more and helps it kind of reabsorb into their system so that they don't have as much swelling in their lower legs. And then if they could wear knee-high compression stockings where they put them on first thing in the morning when their legs aren't so swollen, it should help prevent their legs from being swollen as the day kind of progresses there. So those are all just kind of good educational points to let your patients know so they can kind of be aware of what's going on and follow up with you if they need to. So if you have any questions, let me know.